A group of volunteers deliver love to families in Sichuan. Malaysia city volunteers help a family impacted by a pandemic start their own business. Welcome to Diet Headlines. I'm Sibu Su. Thank you for joining us. City volunteers continue to send warmth in winter in China. Recently, they went to Ya'an City, Sichuan, which was devastated by rainstorms in summer of this year. Before the arrival of the cold winter, city volunteers deliver winter supplies to 325 families.
With the temperature approaching 0 degrees Celsius, Tzu Chi's winter warmth was sent in time. The supplies, whether it is food or other items, filled the car. This aid the resident returns home with full of gratefulness.
Rice, clothes, blankets, and cooking oil. All these are very practical things, and we're too excited to speak. It's really a great help to us. We need to bear a grateful heart.
Volunteer Hu Jie just does the physical work of moving packs of rice. He informed his daughter, who has just given birth, before coming here.
The due date of my daughter was near to the day of sending winter warmth. Yet I must come here to help, even if my daughter gave birth on the same day. Because the master said that we must pass on the humanities to others and all sentient beings through personal experience and let them feel the warmth we send.
For those who can't get out of their home, no matter they are in the mountainous area or living far away, volunteers still send them the supplies personally. The rice and cooking oil supplier also follow the volunteers to distribute, visit the households and fill the humanities.
The temperature here is almost 0 degrees Celsius, and every household burns coal to keep warm. Seeing the grateful smiles on their faces, to be honest, I can feel Tzu Chi's warmth.
This group of volunteers bring Tzu Chi's love to the people in the dark corner, warming their hearts in this cold winter.
In Liaoning, China, a fire broke out at the end of July. A family of 4 were burned by the fire. They had no medical insurance. After the incident, donations came from many places. City volunteers also helped the family.
In July, a big fire broke out. Zhu Yanli and her husband were injured. 90% of their whole body were burned. Her daughter and her father's injury were not that serious, but the whole family did not have medical insurance. Therefore, they are unable to pay the hefty medical fees. As their story were posted on social media, donations came from many places. Tzu Chi also assisted with their monthly fees.
During surgery, we provided 10,000 renminbi for her living costs and costs for hiring a special caretaker.
Zhu Yanli's house was completely destroyed by the fire. Her colleagues helped repaint her house, while Tzu Chi volunteers head out to buy furniture and daily supplies. The items were so many that a truck was needed to move all of them.
We have a truck back home. Tzu Chi's work is also our work. Tzu Chi family is our own family, so I'm very happy today to be able to do good deeds.
It's good to have a group of people like you right now. Whenever disasters happen, you all appear immediately and solve all our problems.
After skin transplant surgery and rehabilitation, the couple can finally head back home and lie on the same bed with their daughter. This has been their goal for the past few months.
After volunteers were very touched that we were able to help this family begin their new lives. We just help out a little bit, but we're all very happy to see their condition right now.
After experiencing rebirth after the fire, with the blessings from everyone, this family can once again embrace their new lives with a happy heart.
In Jordan, a girl, Abir Gannon, suffered from muscular dystrophy. In the year 2000, after knowing her situation, city volunteer purchased a ventilator for her.
Abia Ganam, whose trachea opening is attached with a ventilator, which is the second one that Tzu Chi has helped to replace in the past 2 decades.
حبيبتي كيف حالك؟ تمام هدول بعتنا لك اياهم.
This gift for you is a piece of handmade soap, which is made by a Syrian refugee mother. You can't buy it outside. This is a blessing charm. I'll put it on your bedside, blessing you peace.
سلام تمام حبيبتي.
Back in 2000, Abia's mother used a manual pump to infuse her with oxygen. Tzu Chi's volunteers in Jordan sent a ventilator to their home to save the mother and daughter who had lost their will to survive. Now, Abia is 31 years old, and her mother also has bone spurs because of taking care of her for many years. After knowing the situation, Tzu Chi volunteers immediately sent an electric bed to them. Abia expressed her gratefulness in front of the camera.
مرحبا عمو كيفك؟
شكرا كثير على التخييم.
شكرا كثير على التخييم.
خلينا نشوفك.
خلينا نشوفك.
Over the past 2 decades, what has always been there is a loving concern and care that never fades away with time.
A Singapore city volunteer had a broken marriage and raised 3 children by herself. In the year 2012, she became a devoted city volunteer. However, she was diagnosed with sinus cancer in September this year. During recuperation, she kept learning the Dharma diligently. I have been abused by my ex-husband to the extent that I went to the hospital twice. Once my eyes were hit and almost popped out. I couldn't endure anymore, so I divorced him.
With an unsatisfactory marriage, Hong Wei-dai supported the whole family alone.
I have to raise 3 children alone, so I work as a waitress. I have to rely on myself.
Now she is over 70. She does not start off after unknowing the family burden. In 2012, she joined Tzu Chi and gave of herself every second. Until September of this year, she was diagnosed with sinus cancer. So she has to suspend volunteering activities, yet she kept on learning the Dharma.
Now I have a problem with my eyes, but I still have to watch the master's teachings. If I don't, it seems that I missed something.
With the long-term nourishment of the Dharma, she was subtly influenced and gradually let go of her grievances against her ex-husband.
After listening to the master's teaching about the law of cause and effect, I understood that our suffering in life is because we didn't do good deeds in previous life. So I completely let go of everything. I made zhongzi for my ex-husband since the master told us to go and practice the Dharma in our daily lives.
身体力行。
The unsatisfactory first half of her life has passed. Hong Wei-dai seizes the remaining days of her life to live to the fullest.
We need to do good deeds and speak good words. I have to do it. I won't give up doing what the master told us to do. The medical team from Daling City Hospital came to Tainan to care for 3 recycling volunteers. Although they could no longer do recycling work due to their old age and illness, the love from Tzu Chi continues to support them.
这里有医护站，照顾都很好啦。问题天气冷一点就衣服多穿点就安全。人人都是吃高血压药，高血压都控制在120左右。
When seeing this medical team visit, Songzhe, 95, counts back the memories one by one. And for Dr. Zhang Jiaming, who is participating in his first home visit, is deeply impressed by the sincere interaction.
They'll share with us their joy in doing Tzu Chi activities. In the process, we receive a lot of positive feedback, which supports us and gives us more encouragement and confidence when doing things within the Tzu Chi system.
Bring warmth during the cold winter continues at the next stop as 91-year-old Wu Yuyuan, who suffered from severe depression, opened her heart because of recycling.
I am very grateful to those brothers and sisters. Some of them have been doing recycling for more than 30 years. Some sisters used to be unable to go out because of psychological factors, but after doing recycling, they feel happy every day, as being environmentally friendly can really liven up everyone's mood.
Not to be interrupted by the COVID epidemic, Tzu Chi continues to give love and warmth to recycling volunteers who gave much of their time to protect the earth.
Malaysia, Tzu Chi volunteers continue to carry out pandemic relief plan, providing financial aid to families affected by the pandemic. Among the aid recipients is a couple who have to raise 2 children, one of them with autism. The father had an office job but was laid off. Fortunately, he applied for Tzu Chi's financial aid and started his own business. 28-year-old Maud had an office job, but his company closed down due to the pandemic. Therefore, he has to look for other jobs.
I became a food delivery man. Business was fine during the early stage of movement restriction order. However, later, food delivery man's income has lessened, so I've been thinking about what I can do.
Maud faced a lot of challenges while switching jobs until he was able to apply for Tzu Chi's pandemic relief financial aid. The 3-month financial aid has given him the chance to start his own business.
I saw my neighbors doing business and I asked myself, why can't I do this if other people can do it? So I decided to give it a try. I used the financial aid as my business fund.
Maud has started with a small business. He and his wife work to support themselves.
I found that he is a hardworking young person. Although he faces financial and family difficulties, he did not give up.
After becoming his own boss, Maud has more time to take care of his children.
One of our children has autism while the other child is normal. Now that my husband has become a vendor in front of our house, he can work while taking care of our children. Otherwise, I'll be really tired caring for 2 children.
Volunteers have used simple pictures to teach Mo ways to eat a balanced diet. They hope he has good health to care for his family.
Carbohydrate, veggie dan buah-buahan, lepas tu ada apa? Protein.
I've lost 4 kilograms. My weight went from 126 kilograms to 122 kilograms.
Maud has gone through a lot of challenges he did not expect. With Tzu Chi volunteers' help, he will continue to work hard to support his family. The pandemic in Indonesia continues to heat up. Tzu Chi volunteers from Bandung work with the military and police to distribute masks. This was made possible with the support of an entrepreneur.
Apresiasi daripada Yayasan Buddha Suci ini, hal ini tentunya saya berharap bukan hanya dilakukan oleh tim Buddha Suci saja, Yayasan Buddha Suci, tapi ya seluruh masyarakat Bandung ini harus bersatu padu untuk mencegah dan memutus mata rantai daripada COVID-19 ini.
Bandung Tzu Chi volunteers once again cooperated with the military and police, took to the streets and handed out 1,800 masks. It's necessary to strengthen health prevention publicity and prevent the epidemic.
Senang bisa membantu. Semoga
I'm very happy to be involved in it. I hope the epidemic in Bandung can be over as soon as possible. I also hope people can realize the importance of wearing masks.
memakai masker.
An entrepreneur also donated 1 million masks.
We are grateful for the opportunity to support the community. I hope these masks can reduce the spread of the virus.
During autumn and winter, the epidemic alert was raised and the military, police, and civilians worked closely together without letting up.
Since the outbreak of COVID-19 pandemic, many countries have faced the crisis of the medical system collapse. Malaysia is no exception. An infection biology PhD thinks that to prevent Malaysia's medical system from collapsing, people can follow government's pandemic prevention measures.
According to the World Health Organization, sanitation system serves 6 functions. The first one is to deliver service. The second one is human resource. The third is information system. The fourth is medicine, while the fifth one is finance, followed by leadership management. They are in fact complementary. The public needs an affordable medical system to ensure that when unexpected illness strike, they can obtain timely and reasonable resources. This is especially true when COVID-19 struck.
Since COVID-19 pandemic struck in December of 2019, medical systems in Italy, France, Germany, and many other countries have collapsed. Infection biology PhD Lim Ching Han thinks that when frontline medical staff is short-staffed and there's a lack of medical resources, that means the medical system is beginning to collapse.
As we all know, a country's medical system has limited resources. It means that the local infected patients' number must be under control. When COVID-19 patients take up too much resources, what should we do with other patients and illnesses? So what will collapse first is the delivery of service, human resource, followed by leadership and management.
In Malaysia, the first wave and second wave of pandemic include 22 and 10,145 confirmed cases. The ongoing third wave of pandemic has more than 50,000 confirmed cases already. Due to the high number of confirmed cases, Malaysia's medical system is facing a big challenge. If the medical system collapses, people in international society will lose confidence in Malaysia.
When medical system collapses and patients cannot enjoy normal medical services, patients' condition will worsen and there might be deaths. Then, people will lose confidence in the government's ability to handle the pandemic. Then less people will be willing to obey the government's pandemic prevention measures. As a result, more people will get infected, starting a vicious cycle. I think it's a man-made disaster, and the result is like the casualties caused by wars.
To deal with the crisis, Minister of Health Nur Hisham Abdullah has called all medical staff who meet the following requirements to sign up as volunteers to help the Minister of Health to fight the pandemic. Many members of the public have also left messages saying that although they do not have the medical backgrounds, they're willing to help frontline medical personnel fight the third wave of pandemic. However, if we follow the pandemic prevention measures, we can stop the virus from spreading and therefore fight the pandemic.
If people really want to help the government's medical system, they must accept the correct medical information and knowledge and prevent themselves from getting infected. If they get infected, they'll use the limited medical resources.
Medical system is the front line for fighting the virus, so we must follow pandemic prevention measures in an effort to prevent infections. This is the best way to support the medical personnel. In central Taiwan, Tzu Chi year-end blessing ceremonies began in several communities. Taichung Tzu Chi Hospital Superintendent Jian Shouxing and his colleagues helped make red envelopes of blessing and wisdom.
The red envelopes of blessing and wisdom is the yearly blessing, handmade by volunteers. Taichung Tzu Chi Hospital's medical staff and administrative colleagues, a total of 9 people, came over to help.
Throughout the process of making the red envelopes, I can carefully experience how the masters at the Jingsi abode and how Master Zheng Yan thinks about the meaning of a red envelope.
You have to first calm down, finding the right direction and lines. You have to find the right place.
The medical staff works as a team to make the red envelopes, forming good affinities with the recipients.
In the next 3 days, we'll investigate the role of firefighters. At the beginning of this year, Kaohsiung Fengxiang Fire Department was involved in an accident with a truck. Afterwards, an inspection of fire trucks was undertaken.
One squad leader died. 4 firefighters were injured with light and serious injuries. The price is really very high.
Most of the injured firefighters have not returned to work, and the squad leader Feng Yongchang is gone forever.
他打算什么时候退休？快了吗？还是
就可能在1年啊，但是他提早退休了。我们一家全部已经。
Our family is no longer a happy family. He is a person who is very responsible for the family and loves us. But suddenly, I don't know. I can't talk about it.
突然间这样，真的不会讲。
Feng Yongchang, who has served for 27 years, is a role model for the whole family, but unexpectedly, he had an accident on the way to helping a disaster.
发生这样的事情之后，我才知道说啊。
After the incident, I only knew that when they went to work every day to fight a fire, the first truck that they rode in did not have seat belts. They have no seat belts at all.
Lai Tongsheng sits on the far left. In the middle is team leader Feng and Guo Junjia next to him.
They drove this fire truck at the time. The long bench in the rear cabin was retrofitted. Not only was it separated from the front row colleagues, it also had no seat belts.
This old-model fire truck should be limited to 3 passengers. In emergency situations, multiple people were allowed to ride because the mission requires it.
Older fire department vehicles, which unit needs for transportation, such as in this case, we will recommend that you still install seatbelts.
After the incident, 2-point safety belts were installed, and firefighters wearing heavy equipment had to be fastened in while on duty.
As long as we know the position of the seatbelt, we can find the seatbelt by touching it. It takes us a few seconds to buckle up.
Just a few seconds is not a long period of time, but in many counties and cities, due to safety considerations, finally decided not to transport firefighters.
After it happened until now, there hasn't been further talk about safety or security. Yet, there is still a lot of controversy. Some teams say that if you have not passed certification, then you can't use it for transportation.
Although we are equipped with seatbelts, we also said that it is discouraged to sit inside. It is forbidden for colleagues to sit in the rear cabin when they are on duty.
In order to let firefighters ride without safety worries, the fire department began to encourage counties and cities to purchase new firefighting vehicles.
In some counties and cities, like Yunlin a few years ago, a single-cabin double-tank firefighting vehicles were purchased. This is different from the previous model, primarily in the front of the vehicle. Now, it can carry 7 people and each seat has a 3-point seat belt.
I think this is made by the original factory, so it's safer. And at the same time, the leader and the driver, along with the colleagues in between, can share some information and reminders about tasks.
The old model costs around 1,800,000 USD, and the new model fire truck is about 210,000 USD.
High prices does not mean that safety has been improved, but no one wants to put himself in danger.
The safety of firefighters while driving covers 2 aspects. First of all is the driver's control of the vehicle, and the second is that of passengers and others passers-by.
We need to protect the firefighting personnel and give them the best equipment.
While emergency services is a priority, it is the responsibility of everyone to ensure all operations are safe. The leader of a firefighting unit lost his life, and members of his group are still injured and waiting to return to service. They hope that another such accident will never happen again.
In Taipei, 2020 Healthcare Expo Taiwan has been held at Nangang Exhibition Center. It combines advanced medicine and leading technology. We'll leave you with these images. Thank you for joining us. Goodbye.